Today we are going to learn about some of the metabolic bone disorders and also try to learn about some of the metastatic as well as the malignant tumors of the bone along with the disease of the joints. So we are going to start with the increase in the bone density. Okay, and last time we came to understand that the bone has got cortex and then has got a medullary cavity and as well as the cancellous part of the bone or the spongious part of the bone, which is actually the one that is actually giving down the density by the presence of the trabeculae, right? Okay, so that one is actually called as the bone density. So there are some of the diseases which actually influence this disease. Some of the diseases that actually influences the density of these structures. So there are two ends, which is one is the increase in the bone density, and other may be related down to the decrease in the bone density. So we are going to try to find out some of the densities of the bone first. So we are going to start up with the increase in the bone density. You have to understand, whenever I am talking about the term bone density, you have to make sure that it is something related down to the metabolism. Okay, it is related down to the metabolism of the calcium deposits, okay, which may be controlled by the endocrine system, okay, directly. And it may also be related down to the vitamin levels, okay, particularly vitamin D3, cholecalciferol. And then it may also be related down to the calcium content inside the bones, okay. I think I have mentioned it last time also. There is a difference between the amount of calcium that is present in your serum, okay, in your blood, and also different from the amount of calcium that is present down in the bone. Okay, so what is the investigation of study that we actually do to assess the calcium that is present down in the serum? Okay, it is obviously the serum calcium levels, right? So, if there is increased calcium in the serum, which actually will be happening because that will be either reabsorbed from the bones. So, which means to say, increased calcium in the serum might be an indication of the lesser amount of calcium that might be presented down in inside the bones, or it may also not be there. For example, to say, if the calcium levels that are present down inside the blood is low, we call it as hypocalcemia, right? But that is a direct indicator, of decrease in the calcium levels in the bones as well, because in osteoporosis like condition where the calcium levels, where the bones actually completely get deprived of the calcium, okay, at some point of time where there are drastic changes inside the levels of calcium inside the serum will actually indicate the levels of the calcium which is also present down in the bone, but only in particular diseases as well. But you have to understand these serum calcium levels actually will be changing according to the endocrinal, metabolic, and absorption activities. Okay, depending upon the endocrine, metabolic, and absorption activity, so the levels of the calcium inside the blood will be decreased. But because the bones are trying to maintain equal amount of calcium in them all the time, so whenever the body changes, body senses that there has been a level of decrease in the calcium inside the bones. Yes, it will actually send a signal to the thyroid and parathyroid hormones, and then your calcium levels will be controlled, and those calcium control nutrients are actually being transferred from the by the blood itself. So that's the reason it may be a direct indicator. Sometimes it may not be a direct indicator as well. Okay, So do not confuse yourself that increase in the calcium inside the bones is not may not be technically related down to the increase in the calcium levels inside the blood as well. Okay, we will try to understand this complex mechanism in a little while, but the basic physiology to this one is entirely dependent on the endocrine vitamin levels and absorption conditions. Okay. Right. So first condition we are going to talk about is the increase in the bone density. See, logically speaking, from the first of the radiology, every time we are trying to understand that if there is increase in the density, uh, particularly in case of calcium, we actually see it as a hyperdensity or particularly white in nature, right? So increase in bone density is also as simple as that. On conventional radiographs and on CT scans, what we actually see is that there is an overall whiteness of all the bones. Okay, and such kind of overall increase in the density of the bone shadows is actually called as osteosclerosis. Remember the term, increase in the density of the bone. Overall increase in the density of the bone is actually called as hyperosteosclerosis. You can also call it sclerosis. You can also call it osteosclerosis. The term is synonymous. Okay, it is quite, you are quite free to use the term in any way possible whenever you are talking about hyperosteosclerosis, osteosclerosis, or particularly sclerosis. Yes, we are talking about the same condition, increase in the density of the bone tissues. But you have to understand this is only related down to the musculoskeletal system. When there is an increased density which is related to the calcium in some other parts of the body, you particularly call them as only calcifications. Okay, so let us say, because when we are trying to understand the interstitial lung diseases, when we are trying to understand the metabolic problems, uh, or when we are trying to understand the, some kind of a parasitic diseases, all of them also will have an encapsulated outer shell which may be calcified. Okay, calcification is one of the end product of the necrotic reaction, right? Granulation tissue formation and then calcification is going to happen. Sometimes granulation tissue may also only will be seen, but sometimes granulation tissue along with calcifications can also be seen, right? So you have to understand that calcium is the same density, but it is not in the bones. So that's the reason we are calling them as particularly calcification, which actually meant to say that where the deposition of calcium is happening where it should not be deposited. So sometimes if we see that there is a calcification inside the lung, yes, we are calling them particularly as metastatic diseases, right? But if it is happening in the ribs, yes, you will be obviously calling it as sclerosis. So did you understand what is the difference of calcification and sclerosis? Density wise, both of them are the same. Deposits wise, yes, both of them are the same, but region wise, the terminology is entirely different. Okay, the shadows are same, the deposits are the same, but when you are talking about the particularly system, yes, the description, the term used for them is entirely different. So you won't be seeing sclerosis inside the lungs, but you will be seeing sclerosis inside the rib cage. Did you understand the difference now? Because ribs are bones and bones may also get calcified, and that one is actually called as sclerosis, right? So understand, it's a very, very simple difference. It is not nothing. There is no difference between the deposits there. Even calcium is getting deposited there as well. But the term used them to describe the increase in the bone density is actually called as hyperosteosclerosis. Okay. Now, you have to understand and do not confuse about these things here. It is pretty easy. You see here, uh, there are, listen to me carefully when I actually speak, there are trabeculae inside the bone, right? And Trabeculae, just give me a minute. I will try to find out that picture for you so that it can actually make you understand. Just a second. Just a second. Just a second. Okay, I sent you an image. Okay, I sent you an image. Once, just look it. Let me try to read it on the screen. Can everybody see it? Okay, can everybody see it? Right. Okay. You see here. Uh, you see here. There are some yellow colored, or let us say white colored. Okay, network like pattern all over the bone. Right. So this is actually called as the trabeculae. Right, that's what we are talking, and the region that is present in between them is actually called as the lacunae, or you can also call it as the Haversian canal. Right, lacunae are the one that is actually forming the Haversian canal later on. So this is the trabeculae and this is the Haversian canal, right? And from these gaps you will actually see, okay, from these canals you will actually have the medullary cavity going on, or sometimes later on you will be actually seeing all these areas. This is a particularly a very simple basic organization of the bone structure, right? Now you understand here one thing, okay, where you will be seeing, in particularly in hyperosteosclerosis, what you will be seeing is that, let us say there are two conditions here. Let us say if the density that is present down here, okay, let us take this particular segment. If this one is actually becoming pretty more white, okay, only this segment became pretty more white. It can be happening because of two reasons. Either this all surrounding structure became black, that's the reason this structure looks white, one thing, or only this particular structure became white and this structure remained normal. Did you understand these two conditions here? Yes or no? Yes or no? Right? So you see here, what I meant to say is that when this particular part of the bone actually has to show up on the radiograph as whiteness, it can be happening because of two things. It stayed normal, okay, this one stayed normal, but the whole part surrounding to it actually became black. So that's the reason only this part actually became white in color. Yes. And the second situation is this one, the surrounding structure actually became completely is normal, but this structure became white due to increased density, increased deposition of the calcium, right? So such thing is actually happening in hyperosteosclerosis. As simple as that. So do not confuse. It is not only happening because of the calcium levels, but it is actually the densities actually are being controlled by the organization of the trabeculae. So the metabolism of the trabeculae is the one that is actually determining the density related down to the calcium levels inside the bone. That is what you have to try to grasp here. So the whole part of metabolic bone diseases is just based on this simple principle itself. This point clear, right? So here, what we are at particularly here is, you see here, In case of osteosclerosis, there will be increased density. Okay, there is a overall whiteness of the bones. This actually leads to a diffuse loss of visualization of the normal network of the bony trabeculae. Right? You see here, once there is increase in a particular part of a bone, okay, particular part of trabeculae, okay, when that trabeculae has been increasing in density, there will lead to diffuse loss of visualization of the normal network of the bony trabeculae in the medullary cavity because of replacement of the normal intertrabecular fatty marrow by bone producing elements. Did you understand? The other trabeculae are particularly normal, but they have been lost of their visualization. There is an attenuation in them, which is actually happening because of the replacement of the intertrabecular fatty marrow by bone producing cells. So, which means to say the trabeculae are completely normal, but they are replaced by bone producing cells. So that's the reason the surrounding trabeculae become completely looking black, and some part of the bones are looking white. Did you understand this logic here? Yes or no? Right? Yes? Okay. If the people are still confused, okay, maybe let's, you did not understand, Shafiq? Just give me a second. Okay, okay, maybe I will try to make it a little simple for you. uh okay, try to, sorry, just, no, 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 I will try to make it a little simple for you. Okay, just give me a second. Okay, look at the following images I sent you. Okay, first we will talk about this one. Look at the images I have been sending you so that you can actually try to understand these terms, what actually I'm talking about, or the logic behind this one. Just hold a second. Yes. Anybody interested in computers? Anybody knows the differences between, like what I say, how the pixels on the computers work? Anybody interested, or anybody know what is the difference about them? If you can actually understand the pictures I have been sending you, yes, you will try to understand what exactly I'm talking about the bones here as well. Because it is the density of black and white, so that's the reason actually I wanted to give you these pictures so that you will try to understand about them. Okay, let me share that one for you first, so that we can understand what I'm talking about. Everybody see the screen now here. Yes or no? Can everybody see the screen? You see here, this is a very, very simple, basic science experiment that is actually done for the observation of shadows. Okay, we will just try to understand very, very simply. You see here, do you think that in this picture, particularly in this picture, do you think that the square A and square B are of same color or of different colors? First, you tell me, are they same color or are they different colors? It looks different, right? It looks different. Obviously, one is looking white, one is looking gray, right? But if I remove, if I remove the block here, actually the truth is that A and B belong to the same color. Both of them are of same color. Did you understand? Yes, both of them. Yes, exactly. Same due to the shadow. Exactly, Devendra, you got exactly the answer correct. If you actually remove the block there, they we can actually understand that they belong to the same shadow. To understand this, you have to actually go down and try to refer down a theory which is related down to the Richardelson checkerboard. Okay, the thing is actually called as Richardelson checkerboard illusion. Okay, okay, it is actually called as the Richardelson checkerboard illusion. If you actually see, okay, if you actually remove that one, you remove the green block, okay, you might actually find some kind of videos in YouTube as well, okay, about the Richard Edelson checkerboard illusion, how it actually works. The logic behind it is actually the place A and B, both of them are belonging to the same density itself. But due to the surrounding structure shadow, they appear to be of different densities. That is what exactly is happening in all parts of your body as well when you are trying to look at different densities of black and white. Yes, is this point clear? And there is another situation which is also called as the cafe wall illusion. Okay, the cafe wall illusion actually says that, okay, do you think that these all lines are parallel or they are curved or they are tangentially arranged? Do you think that the all the lines that are present, okay, the gray lines that are present in between, do you think that the all these lines are in straight lines or they are parallel or they are completely slant and oblique? They are obviously parallel, but it actually looks as if they are tangentially going, right? Yes or no? Do you know this illusion part? Yes, I think this is a very famous illusion, right? This is actually called as the cafe wall illusion, okay, right? And maybe let's try to understand the next picture. Okay, this is actually called as the Kafka ring illusion. You see here, when you see here, there is a gray disk. Okay, there is a gray disk that has been placed on two different densities. It has been placed on a black density and it has been placed on a white density. A gray disk is simply placed on a black density and a white density. When you actually move far away the disk, okay, when you actually try to cut down the disk into two parts and try to place equal halves, you see here on the left side, the density of the same gray disk present on a black background appears lighter. And the same gray disk appears to be darker on a white background. Yes? Yes or no? Yes or no? Right? Did you understand? The first, we placed a simple gray disk of equal density on a black and white board. But later, the same disk is cut down into half, and let us say we put one half of that same color on a black background. This became lighter. The gray disk became lighter. And when I'm placing it on a whiteboard, this disk looks as if it is darker. But the truth is, it is of same density, right? And when you are actually trying to see here, when you actually try to move it tangentially and try to make it a circle, okay, uh, you actually see here the gray, when the disk, the same half is placed down on the black disk, actually became much more lighter, and the same thing that was put down here on the white disk become much more darker. So that is what happening with the densities in the parts of the body as well, because the surrounding structures, the density of the surrounding structure is actually controlling if there is a gain in its density or there is a loss in its density, right? So this kind of illusions are actually happening in your body as well. Not only this, you look at another thing here, the same thing is true. This is actually called as the Adelson corrugated plate illusion. Okay, both the squares are of the same color, right? Both the squares are of the same color. And when you actually try to fold the paper and turn it around, these colors actually became different because of the presence of the bent area. You see here, the area has been bent, and this one will cast a shadow on the lower square to cause it more darker, right? But usually speaking, they let it become more lighter. So, which means to say, a whiter shadow falling on a dark image makes it look lighter. Did you understand this? A white shadow falling on a dark image makes it look lighter. That is what happening in our bones as well. Did you understand this part? Yes? Are these illusions clear now? Yes or no, Shafiq? What about you? Yes or no, Shafiq? Right? So apply the same kind of logic on the bone as well. That is what exactly we are, because the surrounding tissues normally will actually cause the leading to the diffuse loss of visualization of the normal network of bony trabeculae. Did you understand? In the medullary cavity, the normal trabeculae are present, but some areas are actually increasing in whiteness, which will actually make them look go light, darker, right? So a black shadow is cast on them, so that's the reason they are appearing lighter. The same exactly opposite thing is happening, same like the gray disk that has been passed down onto the uh, white background, or the same thing that it actually became down white as the black background. So right now here is the black background where the normal trabeculae actually has got lost its visualization, so they started to be appearing dull. So that's the reason the other trabeculae, the other areas are trying to be looking white. Did you understand this part now? Yes? Or still there is a confusion? Yes, the back shadow makes them look lighter. Exactly. White light makes them look darker. Black shadow makes them look lighter. Did you understand? Uh, when you actually, when we complete this class, maybe you try to get down onto the YouTube and try to find out this all of these illusions and try to understand how they are working. Okay, if you look at them in real time video, you will try to understand how exactly the shadows are working. Okay, they are called as the Richardelson checkerboard illusion, the cafe wall illusion, okay, the Kafka ring illusion, and then the Adelson corrugated plate illusion. Okay, you will try to understand they are actually used in pixelization of computers. Okay, how different shadows, how different colors work in the RGB system of the LED screens. This is exactly how the logic used behind them is this one itself. The same thing actually comes down from the shadows. Okay, study of shadows. All right, so that is what actually happening in our bone density also here, which will actually loss of visualization of the cortical medullary junction as well, because the abnormal increased density of the medullary cavity relative to the cortex. So the cortical medullary junction has lost its visualization because of the abnormally increased density of the relative to the cortex. So middle trabeculae became much more wider and the cortex has lost its density. Logically speaking, you see here there has been no change in the calcium deposition, but only some parts are actually being visualized and some parts are not being visualized. That is actually the increase in the bone density. You see here, so in such kind of situation, actually if you do the serum calcium levels, people will certainly remain normal. So such kind of a best example is your diffuse metastatic disease or the carcinoma of the prostate is actually one of the biggest reasons that you will actually see that there is a, in what do you say, the calcium lightness is actually being caused by the metastasis of the prostate here. Increase in the bone density is happening in situation like carcinoma of the prostate. Well, you might be actually having a very simple question. Okay, okay, why the prostate cancer has to do with the calcium. Okay, it is actually known that the calcium metabolism may be related down to the vitamin sorry calcium levels are related down to vitamin D levels, right, which actually increase in the vitamin D levels or the cholecalciferol levels actually also increases the de-differentiation of the cancer cells. Okay, remember this. Okay, increased levels of the calcium causes the increased levels of the vitamin D. Sorry, high calcium intake could actually decrease the levels of vitamin D, which will actually promote the increased de-differentiation of calcium cells. Okay, for example, to say, let us take a person who is actually trying to drink milk. uh, okay, uh, there is an increased calcium inside the milk, but those people will have decreased levels of vitamin D, which might actually push them to undergo, which might then push them to undergo having calcium deposits inside the body. That is what I meant to say. Okay, right? And also, calcium, increasing the amount of the calcium inside the blood may actually try to increase the levels of insulin like growth factor, particularly IGF-1 levels, which also causes calcium deposition. So that is the relation related down to the prostatic cancer, why it actually starts increasing bone density. Okay, is this point clear? Right, the high calcium intake actually could lower the levels of cholecalciferol levels, which will actually promote the increased de-differentiation of cancer cells. That is one mechanism. The other mechanism is that the high calcium content inside the blood will also activate the insulin like growth factor 1 particularly, and starts to increase the levels of the calcium as well. Okay, increase deposition of the calcium in particular body tissues. So that is how the relation between the prostate cancer and the calcium. All right. So we call such kind of a particular disease as the osteoblastic metastatic disease, okay, which actually happens beyond the control of the normal physiological constraints. Okay, if it is occurring beyond normal, we call such kind of a situation as the increased osteoblastic activity here. Osteoblasts are the one that are necessary for the formation of the bones, right? So they will be actually causing the increase in the bone density, and that's the reason there will be increased density, relative increase of the cortex density, because the osteoblastic activity is high there. So that's what it is happening in osteosclerosis. Okay, so we came to understand from autopsies that multiple bone metastasis diseases, from particularly from carcinoma of the prostate, okay, have more frequent and diffuse uh, bone lesions. Okay, diffuse bone lesions. We'll try to look at here in this X-ray. You'd see here there is, okay, there is an increased density of all the bone shadows. You see here there is increase from the density of the bone trabeculae, which actually make them look much more whiter. So obviously you can say this is a diffusely sclerotic bone shadow. Yes or no? So you can call such kind of a condition which will actually suggest you that you are not looking at the bone problem here, but you are particularly looking at a metastatic deposition inside the bones. Did you understand this point? Yes or no? Right? One of the most famous organ for having secondary metastasis to the bones is the prostate. But lung cancer, particularly lung cancer or the breast cancer, is actually having a different metastatic region, secondary metastatic region, right? Where the bone cancer would actually get metastasis down into the lungs. But lungs cancer is going to metastasize in somewhere parts of the body, right? So the same way how the prostate cancer is having its secondary metastasis inside the bones. Is this point clear now? Yes? Yes or no, people? Right? So do not confuse. To keep it very, very simple, to keep it very simple, yeah, we just say that the bones are increased in density. See, Aman, you are not able to interpret this as an increased density because you did not uh, overall look at the normal bone densities in from the normal anatomy. Okay, if you have made that one, you see here you have to remember the basic shadow of the normal bones, how they are looking. Okay, you see here maybe they are present down in previous pictures. Let me see. You see here, look at the same parts here, how they are looking. You can actually see that the trabeculations very, very clearly. You can see that certain parts where there is a lot of stress, okay, where there is a lot of movement, they become ossified a lot. Some parts did not ossify. You are calling them as the spongy parts on the cancellous bone. Some parts are white. We calling them as the cortex, which is the representation of the osteoblastic activity. When you can actually remember, it actually compared to this one, yes, they became much more whiter. Yes or no? So that's the reason I have been telling you, you have to make yourself familiar with the ossification centers of every part of a bone. Right? Is this picture clear right now for you? Yes? Right. Okay. So you can see that there is a diffuse increase in the bone density here. Okay. And we can no longer see the normal trabeculae. Okay. Because they are completely faded away by the increased deposition here. And they became much more whiter and they are dominating the shadow of the normal trabeculae, are the junction between the medullary cavity and the medullary cortex as well. So we cannot see the differentiation of the cancellous bone and the medullary cavities and the cortex differentiation. So that's the reason they appear to be technically much more white. But you have to understand only certain parts are the one that actually became white, but they are leading to the loss of visualization of the normal medullary cavity and the normal trabeculae. That is what the overall takeaway home message from here it is. It might be complicated, but once you understand the concept of what the shadows I have been talking about, yes, this part is quite easy. The whole part of the metabolic bone diseases is just based on this logic itself. Yes, is this point clear right now? Okay, yes, right, okay. Now it will be much more easy and we will try to get faster into the things. Right now all other lesions will be much more easier for us to understand. Okay, now you see here focal sclerotic lesions can also affect the cortex or the medullary cavity, right? And then those affect the cortex will usually produce the periosteal new bone formation, which is actually called as the periosteal reaction. Remember, whenever there is an activated sclerotic process anywhere in the body, it will lead down to calcium deposition. Okay, it will lead to the activation of the osteoblastic cells, and that one will actually start to form a new bone, which is actually called as sequestration, right? Sorry, destruction of the bone is actually called as sequestration, and forming of the new bone is actually called as the involucrum process. And if it is happening in the periosteal layer, we call it as periosteal reaction. As simple as that. Okay, if you can remember your pathology classes, okay, there is a sequential destruction of the bone, okay, and which is actually called as the formation of the sequestrum, and there will be substantial formation of a new bone within the same destroyed area by the activation of the osteoblast is actually called as the formation of the involucrum. Yes, so a bone within a bone formation is actually called as sequestration and involucrum, right? And if it is, this can also happen in the periosteum as well. Okay, so where the cortex will usually produce periosteal new bone formation. So formation of a new bone on the periosteum is actually called as the periosteal reaction. Remember it that way, as simple. And then which will eventually lead down to the thickening of the cortex. But it is not the cortex that has been thickened here, but it is the periosteal layer. Overall depositions have been happening here, which is actually making the cortex look much more normal, much more big, right, and thick. Did you understand the point here? So that one will actually the affect the medullary cavity and will result in punctate and amorphous sclerotic lesion surrounded by the normal medullary cavity. So the cortex is actually having the punctate and amorphous sclerotic lesions where the medullary cavity remain normal. So such kind of thing is actually happening in focal sclerotic lesions, right? So what actually happens? What is the density here? What is the particular condition? Carcinoma of the prostate will have such kind of condition. And the same thing is actually happening where the situation where the necrosis of the bone is also seen, and such process is actually called as the avascular necrosis of the bone. And then there is a particular disease which is related down to the calcium metabolism as well, which is called as the Paget's disease. In the Paget's disease, what actually happens that there will be hypersclerotic lesions. Okay, you can also call them as skip lesions. Okay, when you learn them in Crohn's disease, the skip lesions. Here in bones, also we call them as skip lesions. Okay, some areas are becoming increased in density, some areas are becoming decreased in density. So skip lytic lesions seen on a bone indicates Paget's disease. Okay, right? We will see when you see the picture, you will try to understand this more here. Okay, So what actually happens is that last time I have been telling you the same thing here related down to the metastatic carcinoma of the prostate actually will stimulate the osteoblastic activity, right? I told you it is happening because of the insulin-like growth factor, or it is also happening because of the subsequential lowering of the vitamin D3 cholecalciferol levels, right? So that one is actually stimulating the de-differentiation of the cancer cells. So that is one which is also activating the osteoblastic activity, and it is actually producing high amounts of calcium and produce a focal areas of increased localization of density, right? So that is what happening in carcinoma of the prostate, and these lesions are mostly seen in the vertebrae, ribs, pelvis, humerus, and femur, right? So remember where you have to particularly look if there is an increased density in the vertebrae, increased density in the ribs, increased density in the pelvis, increased density in the humerus and femur. You understand here what all these structures are. All these structures are having large medullary cavities. Yes or no? All the structures which has the large medullary cavities that has been replaced by the increased osteoblastic contents. So that's the reason we are having in only in these particular bones. Small bones generally are not affected. Long tubular bones or the bones which has the large medullary cavity are the ones that are affected here. So if you are looking at the tibia, fibula, or the foot bones, no, we will not be able to understand and suspect that there is the prostate carcinoma. So to look at these particular parts, which we actually do is that the best choice of investigation for focal sclerotic metastasis from any kind of secondary metastasis into the bone deposition, we will be actually doing PET scan. Okay, PET scan we call it as, and we will be doing FDG scan. Okay, right? So you did not learn about the details there, but gold standard is PET scan for metastatic diseases inside the bones. Okay, but on a normal radiograph, yes, we can see that there is an increased density of the vertebral bones here, and you can also see that there are focal lesions. Okay, focal multiple sclerotic lesions, white lesions are present down also on the pelvis as well. You see here, when compared to the other vertebrae, okay, the L4 and S1 bones are completely white, right? So that is what actually is suggesting that it might be this person might be suffering from prostate cancer, right? Okay, so that is simple thing. The take home message is that you have to remember that there is an increased density in the vertebrae, ribs, okay, the humerus and the femur particularly, and there will be multiple sclerotic lesions. So that's it. That is what the radiographic features of carcinoma of the prostate. So don't again ask saying that okay, prostate is a different organ and why it is actually causing and why we are looking at a skeletal X-ray. No, the relation is actually here. You understand? Is this point clear right now for everybody? See, when we are giving down a pelvic X-ray, when we are trying to give an increased bone density X-ray, let us say the question actually suggests, okay, this X-ray suggests the presence of colon cancer, presence of breast cancer, presence of prostate cancer, or presence of lung cancer. What is your answer? I gave an X-ray of this pelvis and I say, what is the answer? What is the reason behind the increased density of this one? Lung cancer, ovarian cancer, breast cancer, and prostate cancer. It is prostate cancer. And if in the options you also say that there is a bone cancer, let us say I'm saying osteosarcoma or chondrosarcoma, please do not choose it because chondrosarcoma and osteosarcoma is not the deposition of the calcium. It is the deposition of something else. It is the increase in density, yes, for sure, but it is not due to the secondary metastasis. Did you understand? Is this point clear? So if you understood this concept, yes, you will be obviously making that question correct. If not, yes, there is a difficulty for you to understand again. Is this point clear for everybody? Yes? Right. Okay. And you see here, the second one we are going to look at is a condition called as the avascular necrosis of the bone. Avascular necrosis of the bone is an ischemic necrosis. Yesterday I was also talking. Every part of a bone has got its nutrient artery, and that nutrient artery is generally supplying the blood. Okay, when we are particularly looking at the femoral head, or when we are trying to look at the scaphoid, okay, the scaphoid actually has got its blood circulation from distal to the proximal regions. Okay, so now let us say in the in the distal regions, if the blood flow is obstructed, don't you think that the proximal region will have its effect of ischemia? Obviously, right? If there is certain kind of a problem that is present down in the distal blood circulation, the peripheral arterioles or the proximal side that they are present will be completely affected, right? So that one will eventually lead down to ischemia and necrosis there in that part, right? So such kind of condition is actually called as the avascular necrosis. And it is happening because of the compromise of the blood supply to the particular parts of the bone, which actually results in the cell death and leads to the collapse of the affected bone, right? So what you can actually try to understand that there will be osteoclastic activation here, right? And there won't be yet osteoblastic activation. Osteoblastic activation requires what? Blood circulation. But osteoclastic activation do not require blood circulation because osteoblasts are already present there. Yes or no? So what happens? Osteoblasts start to decrease and remove the necrotic area, and they will become black. Yes, and the other areas remain normal. So wherever there is a compromise of the blood supply, they will become black and all other becomes white. And that is the radiographic feature of an avascular necrosis of the bone. But however, you have to understand one simple logic here, that MRI is the most sensitive modality for detecting avascular necrosis. Okay, best examples are scaphoid bone in the wrist and femoral head are the one that is mostly affected for avascular necrosis. Okay, on a conventional radiograph, how it will be looking? It will be looking the region of avascular necrosis appears denser than the surrounding bone. Okay, first thing, the area of the avascular necrosis appears denser than the surrounding bone, right? And on an MRI, there is usually decrease from the normal high signal produced from the fat marrow. We will look at the pictures. It is actually happening because the devascularized bone becomes more denser and therefore appears more sclerotic than the remainder of the bone. Okay, this occurs especially in the femoral head and the humeral head. Okay, you see, just let me try to find out. You see here, this is the necrotic region. Okay, this is the necrotic region, the black arrow. Okay, increased sclerosis is there, you see here, and the black arrow is actually showing up as the subcortical lucency. You see here, this one are the fractures and this one is the sclerotic lesions. That is actually, you can call it as a heterogeneous density that is present inside the femoral head. Heterogeneous densities that are present down in the femoral head will generally indicate that you are looking at a case of avascular necrosis. Okay, is this point clear right now? But it is actually happening where the in necrotic regions are actually becoming increase in the sclerosis of the bone, right? Increased deposition of the calcium there, right? Increased osteoblastic activity, increased osteoclastic activity there, right? Fractures, osteoclastic activity, other regions, osteoblastic activity, right? So that's the reason A, that is actually representing the necrosis zone. Did you understand this? Is there any confusion for this one? Yes or no? The one that is destroyed is shown up as a fracture. The one that is actually being normal and increased osteoblastic activity to compensate it is actually becoming white. So an area of black and white together in the femoral head is the one that is actually representing the avascular necrosis. Is this point clear right now? Yes or no? Right? Okay, let me show you a picture so that you can actually try to interpret on a real case how avascular necrosis particularly looks like. Okay, let me transfer you an x-ray. Look at the image I have sent you and tell me which side of the which part of the pelvis or which side of the femur has been having avascular necrosis. Okay, this is a patient of avascular necrosis, but you should tell me which side of the bone has got avascular necrosis in it. Okay, while you do that, we will try to have a break for 15 minutes. We will meet at 11:45. All right.